Pediatrician Dr. David Hall is joining us, who is also a spokesperson for the American Academy of Pediatrics. Good morning, doctor. So this new survey says that more than 40% of parents of younger children say they will not get their child vaccinated against COVID because they're concerned about the long-term possible side effects. So what would you say if one of those parents is a patient?
Many of those parents are my patients, so we get an opportunity to have this conversation regularly. And the first thing I say is tell me a little bit more about what you've heard or what you're thinking, because everybody has their own perspective, everybody's gotten their own information, and the first thing I need to do is understand what their concerns are so that we can address them. In the majority of cases, we're able to address those concerns very successfully because the fact is that we've had tons of kids vaccinated. We've had few side effects and almost no serious side effects. And we know that this vaccine is very protective. So in most cases, when we have these conversations, we're at least able to move parents to a little better comfort. We find with every new vaccine that there's often a little hesitance. People want to see other people do it first, see how it goes. And then when they look around and see that it is safe and that nothing bad is happening, they feel more comfortable with it.
Okay. More than 300,000 children have caught COVID during the past month, according to the American Academy of Pediatrics. How severe were those cases?
The good news is, and I've talked to several of my colleagues in infectious diseases, is that compared to that first wave where I was sending kids to the intensive care unit, I was hospitalizing children, we're seeing a lot less of that. And to me, that is fantastic news. I think with a little bit of caution, one thing that we've learned is more about long COVID, which early we did not know anything about. And long COVID can affect young people. It can affect very healthy people. I know people who are athletes and super high performers who've really been put down by it. So that's one thing to look out for. MIS-C, which is this inflammatory condition that can follow COVID, seems to be less common now than it was, but I think we still have to keep it in mind as a possibility. The other thing to remember is that this virus continues to mutate. So right now things are good, but I think we have to keep our ear to the ground and see what's happening and know that we have to be flexible as this thing changes to adjust our response to it.
What about masks for kids going back to school this fall? Yes or no?
Yeah. I think yes and no. It's going to depend very much, first of all, on the child. So if you have a child who's immunocompromised or who has a history of severe lung disease, for example, I'd be masking. If you have a household member who's vulnerable, I would be masking that child. Maybe they visit an elderly grandparent sometimes. They have somebody in the household who's being treated for cancer. I think, like we said earlier, we're also going to want to stay attuned to what this thing is doing. It's likely to come in waves. And when community infection rates are high, we're probably going to go back to masking more. And when they fall, we're probably going to go back to masking less. So I think we're going to have to remain really nimble and respond both to our individual circumstances and to the circumstances in the community around us.
You either get a great review for your so-called bedside manner, or you are speaking quietly because someone in the house is asleep. Which is it?
I hope we've got our volume turned up, Robin, but I can project if we need.
Yeah, Dr. Hall, thank you. Appreciate it.